Hi there. Good evening. Hi, everyone. Good evening. I'm jumping on here today, and this was a scheduled live. So hopefully, I'll have some of you joining me this evening. I am Eastern Standard Time, so I'm saying evening because now about 6:18 p.m. I do see a couple of you joining, so thanks for joining. Hope catching you guys at a good time. I have decided to do these a little later lately because of the ability really to capture and catch as many people as possible. Since we're all working as nurses, I realize we're busy and can certainly be difficult to catch us all at a good time. But I am jumping on here today. My name's Camelia. I am a psychiatric mental health nurse practitioner. My channel here has been created for PMHNPs, whether it's students, those practicing FNPs, nursing students. So, really just getting on today to share or to answer any questions and really to engage with you guys a little more as we are continuing. Um, and the channel's growing. And so I've learned that a lot of you have the same questions. So I am just here to answer questions that you guys may have specifically about the PMHNP role. Um, we will talk a little bit about one particular topic that I wanted to talk about today, which is a question that I get quite often. That question may actually pop up today, but I will spend some time talking through that. But I am just waiting for you guys to join to answer any questions that you have about the role, and we can certainly jump into other things later. I am going to I try to make these lives only about 30 minutes. So hopefully we'll have some questions and you guys will feel comfortable asking questions for me to answer. So I will give it a little bit of time here. And I'm looking around just to be sure that I have everything in the right spot and um nothing's an issue here. Computers. There we go. Okay. Waiting for you guys to join to answer any questions that you may have about the PMHNP role. I did want to just share a brief topic as I am jumping on. This question comes up quite often, and I actually did a video about this topic about a year ago. And the topic, I've gotten this question like a lot of like many times since then, and so I am going to talk about that here briefly. But I do see a couple of you that have joined, so I just want to give you the opportunity to answer any questions that or to ask any questions that you may have, and we can certainly move from there. So I'll hang around here for just a few minutes. And so far, maybe this is not a good day for you guys, but I am interested in those of you that have questions for me about the PMHNP role. If you are on your journey as a PMHNP, I really would like to know who you are and where you are on your journey, as well as maybe what questions you have for me. So certainly I'll hang around here for a few minutes. What questions do you guys have about the PMHNP role? And I usually try to announce when I'm going to do these lives, primarily because I know we all have to sort of plan when we're going to do the lives and when you guys are available. But those of you that are joining, please feel free to ask me any questions that you may have. This is meant to be pretty informal. I see a couple of you popping in and out here, but please, if you have any questions for me about the PMHNP role, anything that you want clarified, any questions you have as you're on your journey, if you're a student, please feel free to ask me that question here. And you can put the question in the chat if you'd like, and I can certainly answer it from there. Any questions, those of you that have joined, any questions you have for me about the PMHNP role? Any questions at all? I see a couple of you here. At least you guys can put in the chat where you're from. I'd love to know where you guys are streaming from, so that I have a gist of who's here, and some of the things that we talk about can be state specific. So I'd like to always try to cater that to who's here. But please share who you are, and maybe where you're from. And if you have any questions for me about the PMHNP role, please feel free to share that in the chat here. And the one thing that I do want to share as we're waiting on those to join, or maybe put questions here, I did want to share a little bit about. I spoke a little bit earlier about a question that comes up quite often for me as a PMHNP, and that question is around psychotherapy. I think this is something that's less talked about. It's not something that um, many people know as far as the scope of practice of a PMHNP, whether you can or can't, or you should or shouldn't um, perform psychotherapy. So I just wanted to spend a little bit of time talking about that as we're waiting on those of you who have joined to ask me any questions. But particularly with psychotherapy, the way I like to see this is, most of us, if I'm being transparent, most of us do not come out of a PMHNP program feeling particularly prepared to perform psychotherapy. Now, as nurses and also in our programs, most of us have been really trained in motivational interviewing. And so we obviously are doing some of that with patients. We may also have a general overview of each type of modality for therapy, like CBT, DBT, trauma focused therapy. Um, but to be transparent, just working alongside peers that are also PMHNPs, most of us don't feel prepared to actually perform any type of focused psychotherapy for patients. Now, do I have peers who have gone through additional training to feel comfortable doing that? Absolutely. However, with psychotherapy, of course, it's very individualized. It's specific to the patient. And so we have to really be cautious about what we are doing when we open up Pandora's box with patients and we are attempting to perform psychotherapy. I actually perform more supportive psychotherapy. So I do a lot of motivational interviewing with patients, a lot of prevention strategies and things talking about specific things there, and some CBT skills. However, do I have designated um, sessions for just therapy with patients as a PMHNP? No. You will find that most of the organizations, particularly the larger organizations, unless you're working private practice, actually have sort of a dual approach with treatment. And one side is more focused on medication management and treatment, and the other side is focused more specific to psychotherapy. So, with that, most of the time within a scope of practice, you can perform psychotherapy as a PMHNP. However, it is not something that you're going to be highly utilized for in most organizations as a PMHNP. I like to say most of our role has to do with assessing, evaluating, diagnosing, and treating. However, treatment can look like quite a few different things. It does not have to necessarily be medication focused. As a PMHNP, what I'm focusing on is sort of the why and the underlying foundation of what the patient is presenting with. Is it that we need to check additional physical health conditions that the patient may be maybe showing signs of? Do we need to explore other specialists? What else are we looking at, and what's the big picture to really support this patient? Psychotherapy is a part of that usually plan when we're looking at a treatment plan for patients, but it is certainly not something that most of us feel well prepared to just perform psychotherapy in this field. And so I usually, in my approach with patients, is to refer them to a psychotherapist. And where I currently work, we actually do have sort of a pathway for that. But this is a question that comes up quite often. Some of you are going into the PMA as a PMHNP wanting to just perform psychotherapy. Some of you don't want to perform psychotherapy. And so this question comes up a lot about whether you can perform psychotherapy. Um, so I just wanted to kind of lay that out there. It's not something that's talked about a lot. Will you get some information about it? Will you get some practice? Will you have to follow therapists and as a part of your program? Yes. But is it substantial to enough to have you go out and be ready to practice as a therapist or to perform focused psychotherapy? Usually not. So I like to just lay that out there so that you guys understand that yes, we can perform it, but we have to be careful and cautious that we also are not doing any harm to the patient by assuming the role of a therapist when we may not have the tools or be as versed in performing psychotherapy. Okay. So I just wanted to share that. I do see a couple of you popping in and out. But certainly, if you guys have any questions for me as you're here, at least let me know where you're from. And I'd be happy to answer any questions that you have about the PMHNP role. This is going to be, it is recorded, obviously. So I did actually just share some information about psychotherapy. That's a question that I get quite often. So I'm just really here to answer questions for you guys. I'm not going to be on too much longer, probably about 15 minutes or so. But if you have any questions for me, if you're on a PMHNP journey or if you're considering that, and you have specific questions that most of us have the same questions, then feel free to drop that in the chat for me, and I'm happy to answer that for you. So I'll just wait. I see a couple more people that have joined. Esther, thank you so much for joining. And no problem. I try to do these lives about once every month. And I do try to plan ahead and let you guys know when I'm going to do it. But the real goal of this is to just answer any questions that you guys have in real time. I get a lot of messages from YouTube. I get messages on email, LinkedIn, and just a little bit of everywhere. And so I figure the best way to kind of answer the questions that I'm getting like repetitive questions about would be to just share it in one space. So that's the goal of me trying to do these lives at least once a month. But please tell me, Esther, maybe where you're from, or if you have any questions for me, those of you that have also joined. Please feel free to put those questions in the chat and we can discuss anything that you'd like to for these next few minutes. But happy to really share or answer anything that you have. Any questions that you guys have for me? Ask me anything. I usually like to say that I don't know everything. I have been practicing for a few years, long enough to see some things and to have some insight. But certainly, if there's something that I have not experienced, I'll be sure to be transparent with you guys about it. And if I can seek other resources to help support you in some way, which I've done for quite a few people offline, then I will do that. But my goal is just to continue supporting those that are coming through a PMHNP program. You're practicing, maybe you're an FNP, and you are looking to move forward with the PMHNP, or maybe you're an FNP just working in psychiatry generally, and you are joining. You've joined the channel. So I've had quite a few of you join recently. So thanks for that. Um, any questions? I thank you so much. I have a question here. So first of all, Esther, congratulations. You're currently an FNP and you are in school for a PMHNP. So Exciting. It sounds like you actually will have quite a bit of probably job opportunities and be able to support both roles. But hang in there. I know some of the courses can be a little tough, particularly psychopharm and advanced pathophysiology. You may have taken that course already, but certainly congratulations to you. I do have a question from Farmer Nurse. How hard is it to go from PMHNP to FNP? Okay. This is a question that I probably can't answer because I am not an FNP and I've never been an FNP. I've only worked in nursing for about 11 years before I decided to go back to become a PMHNP. Worked a little bit of everywhere, but have not pursued the FNP route. So maybe that's a question that you could ask. Maybe someone else can answer that question, maybe here in the chat. But how hard is it to go from the PMHNP to FNP? I don't know the answer to that because I haven't experienced it. What I will say is it's probably easier to go from an FNP to a PMHNP, just generally speaking, because you have more of a broader scope with an FNP, and then you're kind of honing down to things as a psych NP. I would suspect that that's a little easier route. But obviously, we have lots of dually certified nurse practitioners who can probably answer that question a little better for you. And Farmer Nurse, I'm interested to know, are you a PMHNP currently? Or are you an FNP, or are you a nurse going back to become a nurse practitioner maybe? Feel free to share that in the chat. One thing that I am gonna plan to do, guys, most of you who've been following me for a while, know that I have a twin sister, and she is actually an FNP. So I am planning to have her join us at some point because she has a little more insight. She has been practicing longer than I have. But I think she may have some insight for you guys who are either FNPs, or if you're FNP considering a PMHNP, or vice versa. So I will be having my twin sister, her name is Courtney, join at some point soon so that we can discuss maybe some of the differences between a PMHNP and FNP, and maybe some of the things that we've seen practicing in our different roles. So more to come on that. Farmer Nurse, I apologize, I can't answer more for you right now. But you are starting to search for a PMHNP school in Florida. You can't have an independent practice. And I'm assuming you can't unless you have possibly an overseeing physician or a supervising physician. And you can answer that question for me. But North Carolina is also the same. We are not an independent practice state. And so with every job that I have had as a PMHNP, I have had to have a supervising physician. Um, Also with private practice. So it is a little different and compared to other states, but certainly all states right now, of course, we haven't gotten there yet, are not independent. Um, Esther has a question for me. What's the best way to build on your skills quickly in this specialty? I would say a lot of real time practice and interviewing. I think most of what you do as a psych MP is going to be based on your ability to actively listen, and it's going to be based on your ability to get the right information from the patient. Of course, we do that anyway as a nurse practitioner, as nurses, but particularly in psychiatry, um, patients are going to share what they want to share. And so your job is going to be to get from them what you what you're able to get from them to help support them better. Sometimes they're guarded about information, other times they just simply may not know. And so your role is going to be to be a great interviewer so that you can be sure that you're getting the most information to help support the patient in the best way. So the best way to build on your skills is just to practice. You may not have real patients to do that with, but you may even practice interviewing skills with family members or other people, maybe colleagues that will help you to kind of fine tune it enough that you're able to um, support the patient in the best way or feel comfortable just kind of jumping into to help patients in this field. Um, Medication management is another side of this. As a PMHNP, a lot of reviewing and kind of going back to resources. So Stalls is a good resource. There are quite a few more resources out there that others have used for more specifically for psychopharmacology. Um, the good thing that I usually say about PMA as a PMHNP is that there aren't that many medications that we're working with, and so essentially you kind of learn the characteristics of each medicine and kind of when to use what over time. But as far as resources, Stalls, Psychopharm, there is also, I think, a pocket guide for that. Is a pretty good resource, and that's held pretty steady for the last few years. But there are other ones out there. But active listening, supporting your interviewing skills, and medication management, I think, are the biggies with this uh, in terms of your skills here. And then, psychotherapy is something that most of us, as I mentioned initially in this video, we don't really do a lot of all the time. And so most of us are not necessarily versed or as comfortable doing just psychotherapy. But there are additional trainings like the Beck Institute if you want to hone your skills for therapy. Certainly, there are other resources out there for that. So I hope that was a long-winded answer, but there are so many different kind of skills that you will have, and you can usually, continue to develop as you practice. But those are the biggies I would say from a day to day, even from me starting out as a new grad until now. Those are still the things that ring true for me every day. Yeah. And I do see another message here. Unless you are a primary or FNP, I think you may be referring back to being independent, like an independent practice state. I'm assuming you're mentioning in Florida you don't have to have a supervising physician if you're primary or FNP. You can clarify that for me. But here in North Carolina, I'll just say across the board, we have to have a supervising physician. We are really one of the states that that's considered more strict in terms of our practice. So hopefully that answered something for you guys. If you do you have any more questions for me? Anything else as a piggyback to what I just mentioned? If so, just place that there in the chat, and I'm happy to answer it for you. And I'm happy to clarify. I do a lot of kind of answering questions offline. So if there's anything individually that you guys need more information about, feel free to ping me. There's an about section on my channel that you can contact me by one of those methods, and I usually get back to you within usually a couple of days. So feel free to use that if you want something more specific. But I'll hang around here. It looks like it's about 6:41. Any questions that you guys have for me now, please feel free to put those in the chat, and I'm happy to answer those. But this is recorded. It's being recorded, so you can always refer back to it. And if you have other questions, like I said, that are more individualized, feel free to ping me offline. Any more questions you guys have for me? And we'll hang around here for about 5 more minutes or so. And you guys can put those questions in the chat if you have any. I see a couple of you kind of popping on and off. So, um, any more questions for me right now about the PMHNP role, or really anything you want to ask me, you can. Any questions you guys have for me right now? Well, I'll certainly continue doing these lives. You guys can look out for a message from me. Usually I place that on the community channel. I have one more question. I'll certainly answer that now. But what specialty do I recommend in the PMHNP role? It really is very individualized. It's up to you as to what you feel comfortable with. Um, Most people work in more of the, well, I'll say for myself specifically, there are areas that I love to work in and areas that I did not. Really like working in for various reasons. So there's kind of these hubs of psychiatry. I have worked mostly in outpatient psychiatry with adults. I did start out working with children, but my preference is to actually work with adults. So I work from 18 to 65 and older. I do have some geriatric population, but as far as specialty, I have worked mostly just general psychiatry. Um, the emergency department does have a little bit more of a mixed bag. So I have worked in the psych ED as well. And in that, I was able to see a little bit more of different different types of patients and different things that we were treating. However, I have not worked in substance. That I did a couple of clinicals while I was in my program with substance abuse. And that's the one area that I haven't worked in. I would say where you're going to get the most experience in terms of learning is probably going to be general psychiatry. It's just like anything else in nursing, in my opinion. If you specialize too much, then you are only going to get just a subpopulation of patients and an understanding of kind of when and what to do. However, if you broaden that to general psychiatry or broaden it to where you're seeing more diagnoses, different types of patients, then you will learn better there. And so that's been my general rule for, at least for now. For me, I've been in mostly general psychiatry and outpatient. The inpatient world is different in a lot of ways. I did a video comparing the two, but you generally are going to see the same types of patients that you would outpatient. The only real pocket in psychiatry that does require more specialized training usually would be if you're working with a particular population like autism spectrum disorder or if you are working with substance abuse. So if you're looking to learn, I would say general psychiatry, that can be inpatient, outpatient. You're going to learn quite a bit there. And I also would recommend that you kind of go based on what your clinicals tell you. You are going to probably be exposed to different things. I know it's very hard for most people to find clinicals, so most of us are not choosing our clinicals these days. But certainly, you can get a good gist of working with certain specialties within psychiatry or as a PMHNP while you are in clinicals. It may give you some information. I knew that I did not want to work with children. I love children. However, it was not where I wanted to spend my to focus as a PMHNP. And so I knew that based on my clinical rotations when I was in my program. So it was a preference for me, and it's something that I've kind of stuck with for a long time. Hopefully that answered your question. I'm not sure if I touched on what you wanted me to, but certainly you can follow up with any other questions that you may have. Any other questions you guys have? I have a couple more people that have joined, so I do want to just be sure I'm giving you guys the opportunity to ask any questions. This is very informal. It is recorded, but the goal is to share or ask any questions so that we can generally have a space where I am able to answer those. Since most of us, like I said, have the same questions. So any questions you guys have before we end this evening? And for me, it's 6:47 p.m. Eastern Standard Time. And so certainly if you have any questions, I am going to stay around for a couple more minutes. Um, and you asked me also, what podcast do I listen to? I currently don't listen to any podcasts, so I don't have any recommendations. There are quite a few PMHNP gurus on Instagram that may have podcasts, but I have not been regularly following anyone in particular. There are a lot of or neuropsych or psychiatry, like psychiatrists who have podcasts. I can't name any of those though, because again, I don't follow them regularly. I have learned mostly from just practicing, but I have had some very, very, very good supervising physicians that I've gleaned a lot from. And so, of course, we can all get more information and grow and continue to learn. But I haven't done that by listening to podcasts so far. But you bring up a great idea, so I certainly will seek out maybe what where the podcasts are right now, or who's a good one to listen to. Any other questions for me before we end tonight? Yeah, so I want to thank you guys for joining. Thanks for subscribing. Most of you have been around for a while since I started this channel in 2020. So I do want to take this time to say thank you. If you don't have any more questions, certainly we'll do these lives about once a month. And I look forward to seeing you guys in the next live or maybe the next video. You guys have a good evening.